Okay, great. My name is Jules Wesson. I'm an admissions advisor here at California Health Sciences University College of Osteopathic Medicine. Um, Today, we are offering an all things clinical rotations info session. One of the most frequently asked questions we get as an admissions department here at CHSU Com is basically anything related to clerkships, clinical rotations, one's third and fourth year of medical school. Obviously, clerkships are a crucial part of one's medical school experience. And so we decided to offer this session to give prospective students greater insight into what those 2 years will look like here. So because we only have 30 minutes, we have a bit extra just in case the Q&A runs over time. But I should go ahead and introduce our two speakers today. So first, giving his presentation, we have Dr. Jonathan Terry. Dr. Jonathan Terry is the Assistant Dean of Community Clinical Education here at CHSUCOM. And our Community Clinical Education Department is tasked with finding clerkships, preceptors, and rotation sites for our third and fourth year student doctors. And Dr. Terry, he's also an Associate Professor of Specialty Medicine here. So he's going to give his presentation. We ask that you reserve all questions until the end of his presentation when we transition into the Q&A portion. The Q&A portion will feature not only Dr. Terry, but Tatiana Abdul Noor. Tatiana is a fifth year here at CHSU Com. She is one of our OPP scholars, with OPP standing for Osteopathic Principles in Practice, meaning she's one of the special students who has elected to take a fifth year to learn additional osteopathic techniques and to acquire additional scholarly and clinical experience. So she already has those 2 years of clinical education behind her. So we really appreciate her offering that insight. So without further ado, I'll go ahead and turn it over to Dr. Jonathan Terry.
Great. Thank you, Ms. Wesson. So much appreciate that kind introduction. I just want to really welcome everybody for spending part of your Friday afternoon choosing to learn about clinical rotations at CHSUCOM. That is awesome. Just a really quick overview. Many medical school curricula are set up similar to ours, where a student will spend the first 2 years of their curriculum largely in the classrooms. They're learning the skills that they will develop to then go out and use those skills with patients in our clinics, in our hospitals. And so my job as the Assistant Dean for Clinical Education is to help all of our third and fourth year students be successful in a wide range of specialty areas. What I'm going to do is share with you 5 different web pages, all of which are publicly available. So I'll also be putting those links to the web pages in the chat, and that way you'll be able to, you don't need to screenshot anything, although you're certainly welcome to screenshot things if you like from my part of the presentation. So that way everything that I talk about will be available to you later. I'm also going to try my best to finish up talking in about 10 minutes to allow plenty of time for questions and answers. So I'm going to share my screen, which is always just slightly awkward on Zoom while you're clicking the buttons to make it happen, so hang tight. Okay, can I get a couple thumbs up if you can see my screen? I like it, thank you. So again, I'll be putting these links here in the chat once I finish talking about them. So the first of these links talks a little bit about our clinical education curriculum. And I like this because it outlines in general how the time is spent. The third year of rotations are what we would call core rotations. And that's when a student spends time in family medicine, internal medicine, pediatrics, psychiatry, women's health or obstetrics and gynecology, and surgery. Some of the things that I really like about the way our third year are structured is that the year actually starts, the first course in our, I'm sorry, the last course of our second year is actually a board preparation course. And this is really kind of a unique thing that CHSU-COM does, where we have dedicated time set aside to allow students to focus on studying for their first level 1 COMLEX, their first national boards, and then they take that right at the beginning of their third year. We also have the students take a class called Entrustable Professional Activities, or EPA, and that's a chance to really practice all of the clinical skills to learn things like how you scrub into a surgical OR. And it's very much a clinical hands-on course that then prepares the student to go into these months of family medicine, internal medicine, as I mentioned, pediatrics, really just these core disciplines that are going to ultimately prepare the student not just to be a great physician, but also for their level 2 COMLEX exam. Our students are very successful coming out of their third year, so they're fully ready to take that exam and be proficient in these areas. Now, third year, we have an incredible team that I'll be introducing you to on a later page that helps to schedule all of these rotations. And so a student might be in general surgery for one rotation, and then we actually have a great relationship with our level one trauma center in Fresno. So students will go to brain surgery or neurosurgery or specialty surgery for the surgery too. Similarly, we'll have them do a general internal medicine rotation for internal medicine one, but internal medicine two might be a specialty area such as gastroenterology or cardiology or pulmonology. So our students have just these really incredible experiences. One of the things I should also tell you about our third year rotations is much of our curriculum is what we might call a distributive model or an apprenticeship model, where our third year students are often working directly with an attending physician. We don't yet have a teaching hospital of our very own, but I actually think that that's a strength because in the process of third year, our students will work with different residency programs, they'll work in different systems, and they'll be first assist on surgeries. It's very rare for us to have a student, for example, who gets through a week, their first week of women's health, without delivering a baby by themselves, which is an absolutely incredible experience where if you were working with tons of residents and fellows, you might not get that same experience. Moving on to the fourth year is much more unstructured in the sense that we open it up to the student to have a ton of electives or audition rotations. So if I, as a student, say that I really want to go to residency, say here in Fresno at UCSF Fresno, I'm going to try to do an audition rotation there and spend my time there, but also earn credit toward my DO degree while I'm doing that. Our students also do rotations in emergency medicine. They have primary care selectives, an underserved medicine selective, but most of the fourth year really is this elective experience. Similar to how we had the third year curriculum, at the beginning of the fourth year, our students also have a board prep course that is specific time, totally set aside, not on rotation. That's just for enrolling in a course to help be on the get the best score on those exams, which helps makes our students increasingly competitive for the residencies, for which we have had a 100% match for each of our graduating classes so far. And I think a large part of that is because of this robust curriculum that we have. And Tatiana will be speaking a little bit more about that. Now I'm actually going to move over here to the Maps page. Everybody's seen Google Maps. And for those of you who are, applying to Fresno, here's where we are in California. Wonderful place on the map. Weather's a little bit questionable in the summer, but 9 months of the year, it's pretty beautiful. Most of our rotations are pretty close to Fresno for the core rotations for third year. For students who have geographic abilities, we do have some rotations that will extend to the Bay Area and to Southern California, but that's not something we require. It's if a student has, an aunt or a home in Anaheim and they really like going to Disney on the weekends, we have some ability within our rotations to do that while still supporting our mission of serving the Central Valley and making sure that a student does have a number of rotations here in this highly underserved area. So it's really this area between Modesto and Bakersfield that our school hopes to serve. And we do have over 400, actually close to 500 different sites that our students may rotate at in this area. Students do get to submit preferences, and we do try to accommodate as many of those preferences as possible. Now, this is my department's website, and again, I'll be putting all these links in the chat for you. But we do have this clinical education team. This is what I looked like before I was on Zoom this afternoon. And this is our director of community clinical education. But we also have 7 coordinators here. And students are assigned an individual smiling face here who's going to work with them individually to get to know that student, to say, hey, you're interested in pediatrics. Let's make sure that you get the rotation at Valley Children's Hospital, which is a Stanford affiliate, just about a half hour north of us. We're going to try to work with you to make sure you get the best rotation possible. Those are some different things about our clerkships. I'm just clicking around here to see what other things I need to show you. I'll also be posting a link here in the chat about our rotation schedule. So you can get a little bit of an idea. For OMS 1 refers to a first year osteopathic medical student, second year osteopathic medical student. As you move forward into years 3 and 4, if you want, say if you're planning ahead a couple of years, you can get an idea of what these calendars look like. The reassurance that yes, you do get a winter break. Yes, you do get some breaks in here. And you also get an idea for when, even though it's not on here yet, match day, day that every fourth year medical student looks forward to. I see some nods from those who have their cameras on. That shows up usually in March of every year. So I'll be putting all of these links in the chat. I'm going to stop sharing my screen here. And I think I'm going to pass it to Tatiana. And don't let my posting of the links in the chat distract from her excellent presentation. I love listening to her speak, and we are super proud of our third and fourth years. Tatiana's just one of our shining stars, and I'm so excited to share the Zoom stage with her.
Well, I really appreciate that introduction. That was great. Thank you so much. Hi guys, my name is Tatiana. I don't really have a formal presentation. I was kind of asked to join in and answer a lot of questions. A lot of times when they do these sessions, people like to hear from the students and kind of get their perspective a little bit. So really, I want to leave a lot of this to whatever questions you may have. If you don't have questions, I love to talk, so I'm sure I will come up with a lot to say about it. I can give you maybe like a brief overview summary of kind of how things have been, and then any questions that kind of pop up from there, chime in, raise your hand, or I'll like ask if there's any questions, okay? So I have completed my third year. Technically I have enough to graduate, so I'm actually very excited about that. So I did an additional year to medical school because I'm crazy and I love teaching and I love our program and I kind of want to be a part of giving back to that. So because of that, I had the opportunity to do a lot more rotations than most people and kind of set my schedule in ways that benefited me for applying towards residency programs or just things that I really wanted to see or get like a little bit more information in. Your third year is structured a little bit more for you. You won't be on the same rotations as other students. So your first 2 years, you get to really know your class very well. And then third year kind of happens and everyone's kind of off doing their own thing. We do kind of have these little like monthly regroups, whether you're doing the way we do exams are called COMATs, which is kind of like your monthly national exam that you have to take to see if you really like learned something. And you do them at the end of each one of like the courses that you complete. So whenever all the med students get back together for that, we're kind of like, oh my God, what did you do? And we're sharing all of our trauma experiences and the way we bond over, everything that we kind of went through. So it's really nice because you can touch base about it and then hear about other people's rotations and how it's kind of gone. So typically there's 2 family medicine rotations you'll do, 2 internal medicine rotations you do, 2 surgeries that you'll do, 1 pediatrics, 1 OB/GYN, and that pretty much makes up the bulk of like your third year. So everyone will be on different rotations doing different things at other times. There's times you'll have other med students with you, whether they're from your class or other classes, and there's times that you'll just kind of be the only one there with your attending. Um, I wouldn't say there's one that's better than another. I think it's really nice to get a mix of both. It's nice to have a buddy where you're like, did we read that cue right? Should we walk over? Should we stay here? It's a very exciting new realm of reading social situations and not knowing where to go and trying to stay out of the way while learning as much as possible. So having a buddy for that is really great. Especially if you're getting pimped, meaning like if an attending's kind of asking you some questions and you don't know if you'll answer it, you have a buddy who can kind of help you out. So hopefully between your 2 brain cells, you can kind of piece something together. Um, Being on your own is really great too, because you get a lot of one-on-one attention with your attendings. I think overall the experiences I've had, all the attendings are really great. Everyone gets really scared that attendings are going to be mean and bite your head off. And it's honestly not, I mean, maybe it is on some places depending on where you go, but for the most part, I would say I can speak for myself and for most people, it was an overall really great experience. Attendings are really excited to have you. You just need to come in showing that you are ready to go, that you're excited to be there, you want to learn, and I think you're just going to thrive from there. I think the hardest part for medical students, many of us are very type A, and we like to have a system and a schedule and what's expected of me and what do I have to do. And you have to realize you're joining a little bit of someone's world. They're not thinking, oh, Tatiana's my medical student who starts on Monday. Let me make sure I give her 2 weeks advance notice of everything and every single thing she's supposed to do and how to prepare. They're just out there living their life. And every month they get a new medical student. So having what I like to tell people is get comfortable with being uncomfortable. It's going to be okay. I'm about to start a rotation on Monday. I do not know when I'm supposed to be there. Will I be there at 7 a.m. though, just to be ready? Yes, probably. That's what comes with it. And it's all going to be just fine and it's all going to be okay. So it's a great learning experience. Get comfortable with being uncomfortable. You're going to learn a lot. You're going to see a lot. You're going to get to do a lot. Your first 2 years are tough. We have some of our faculty that both teach clinically and also like during your first 2 years, and they also teach like out into clerkships, and I've had them for both. And they'll tell you your best day of your first and second year. Oh no, excuse me. Your worst day of your third and fourth year is still better than your best day of your first and second year. And it's very true. First 2 years are tough. They're hard. I won't lie to you. But then you finally get to go do the thing you really wanted to do. You get to be in clinic and you get to be a part of all these wonderful experiences. Even if you're not a surgery person, the first time you get to go, and it sounds crazy to other people, but in the medical field, we all get it. And you hold a uterus in your hand for the first time, and you go, what did I do to have this privilege? What did I do for a patient to trust me to be here? All those years, all that schooling I did brought me to this moment, and it's absolutely unreal. It's something that most people in this world don't get to experience, so it's such a privilege. Um, so there is light at the end of the tunnel. You will get through it all. That's my brief general summary of everything. I am open to any questions anyone has.
Thank you so much to both of you. We can go ahead and open up the Q&A portion. So like I said in the chat, you can go ahead and use the raise hand feature, or you can write questions in the chat. And then Dr. Terry and Tatiana, you can just go ahead and call on people.
Okay. I see Tilly has a hand up.
Hi, yes, thank you so much for putting on this presentation. And it's just really nice to hear your enthusiasm about the program and rotations and everything. And so I guess my question was just, are all the rotations typically done at one hospital, or do you get to, could it depend, I guess, just on where you're placed?
Yeah. And Tatiana, should we rock, paper, scissors for answers, or do you want me, or we can, switch off? I know you know the answers as well as I do.
You can go for it. I'll let you do the big clin ed department ones.
Okay, that sounds good because I see Borna's got his hand up for the next one, and that's going to be a tough question. So Tilly, to answer your question, it's so some of it is based on site availability, and some of it is based on what our students want to do. So, for example, we have a local partner here, another big trauma center hospital. It's called St. Agnes here in Fresno. It's a 500 plus bed hospital, incredible learning experience, and they have multiple residency programs. We have several students who say, hey, I'd really like to do as many rotations as possible in this one hospital so I have a better chance of being a good applicant for their residency programs. And we say, great, we'll try to accommodate that. Other times it is a little bit more of students in different areas. And what we'll try to do is align a student, say somebody who's surgically oriented, we'll try to get them into opportunities and sites where they'll have more procedural experience. So it's really very individualized how it's set up. But most students who rotate with us do end up seeing multiple systems. That means they get to train in multiple EHRs, and they get a variety of letters of recommendation for their residency programs, right? So think of how cool it is for the student who's applying for residency wherever in the world, and they have a letter that's on Stanford letterhead. They have a letter on UCSF letterhead. They have a letter on United Health Centers, a local federally qualified health center, a migrant health center that we work with. So our students get very robust and diverse experiences, but often do get to see multiple places.
Thank you.
Okay, I think you had your hand up, followed by Matthew.
Can you guys hear me all right?
You sound great.
Perfect. First and foremost, thank you, Dr. Terry and Tatiana, for the wonderful presentations and all your insights. I just had a brief question about the housing. So, when you're a third year and let's just say you're rotating far away from the school, does CHSU provide you with any housing support or any funding for, the apartments you might get that might be far, from the campus or anything like that when you're doing like away rotations or rotations at like a hospital that's just far from the school?
So I can go ahead and step in for that. So one of the beautiful things about CHSU is that we really gear a lot of our rotations to be, I would say 30, maximum 45 to an hour, I would say, from the community. And it's geared that way for a couple different reasons. Our big mission statement is we want to bring doctors to the Central Valley and help support the Central Valley. And so to do that, you get to know Central Valley people. There's a different way of living, a different thought process, a lot of cultural nuances that you may not expect. The level of health education and literacy is very, very different. And I actually think that's one of the biggest perks compared to a lot of other places because you understand you could be a great doctor. If your patient doesn't understand what you're saying or doesn't have the resources or the means to do those things, you could write prescriptions or talk as much as you want. It goes in one ear and out the other. You actually really don't make much of a difference. So when you work in the Central Valley, you'll see, oh, you have transportation issues, or you have finance issues. Oh, culturally, it's not accepted for you to do these things. So you're learning medicine in a whole nother way than a lot of places cannot teach you. You're learning how to be a physician. You're learning everything that kind of ties into it. So because of that, you typically don't really need to go anywhere, especially for your third year, which is really nice. A lot of other medical schools, their sites can be in different states and you got to go figure it out. There may be some med schools that give you some kind of a stipend for that. I have not seen that as far as my knowledge goes. That's typically on your pocket. So it's very nice to know that you really don't have to go anywhere. You don't have to pay for that. When it comes to fourth year, those are like doing away rotations or your sub-Is, which I can go more into detail if people would like me to, but that's you scheduling places that you would like to go rotate at to make a good impression. That's really on your pocket and your expense too. So if you want, you could complete all of your third year and your fourth year within the Central Valley and local to Fresno. I will say, I am originally from Orange County, and that's where I am right now doing a couple of my rotations. LA traffic sucks. It is horrible. I was doing a 2-hour commute to UCLA every single day, and I hated my life. In Fresno, we don't have traffic. We don't have traffic. It doesn't, people don't go on the freeway. You can, and you'll go there for 10 minutes. So Dr. Terry hinted to Valley Children's. It's the only standalone children's hospital for the entire Central Valley. It's roughly 30-ish minutes, but it's just streetlights. I've driven an hour into the mountains, into the middle of nowhere. I would much rather take a beautiful scenic mountain drive that's actually really peaceful in the morning versus an hour and a half to 2 hours that I go to like UCLA sitting in bumper to bumper traffic. So to answer your question, no, we don't really do a lot of compensation for like housing if you're going to go in other places, but the beauty of it is you can really do all of your rotations in Fresno, so you don't need to sublease, you don't need to like worry about paying rent or finding other places to be, which is really great.
Thank you, Tatiana. That's such a great answer. I will just supplement ever so slightly to say that for some of the fourth year sub internships, some of the programs do offer housing as a part of their deal. So those are, fourth year again, it's anywhere in the United States just about is fair game. So I can speak. There are several programs on the East Coast that do have some housing or highly discounted housing for that because they expect students from all over to be visiting. All right, Matthew, I think you were up next.
Yeah, thank you guys again. And my question is, do you typically follow just one attending during a rotation and match their schedule, or is it a more consistent schedule and then you're following a team?
Great question. I see Tatiana looking at me for that one. So it really depends on the rotation. So for example, if your rotation is with a residency program, you're going to be working with different residents and different attendings. We do have some of our rotations that are in private practices, and it's actually a really cool experience for students to have that exposure because so much of medicine is practice, and you get to learn about the business of medicine as you're doing it as well. So it really just depends on the rotation. I will say that if you are a person who likes to be kind of in the corner and not participate, our rotations will not be a good experience for you because there is so much participation, whether you're working with multiple attendings or working with just one.
Awesome, thank you.
Thank you. Selena, I think you're up next.
Hi, Tatiana and Dr. Terry. I was just wondering, I had a question about your personal experiences during rotations. I was wondering, what would you say are the extent of the responsibilities given to you as a medical student? Because I know you said that some students in women's health are given the opportunity to deliver a baby, and I was wondering how common this was in other rotations like surgery. Are you allowed to participate in procedures, and how often are you acting with those same roles and responsibilities of a practicing physician?
That's a very good question. And it really depends on who you're working with. Um,
Mhm.
you could be an OB-GYN rotation where maybe they want you to be a little private practice. Maybe it's like, you know what, I do the pap smears because these are my patients and you can just kind of watch and shadow. And you may have some that go in, do your thing. Let me know if you need anything. And you're like, okay. So it really, really depends on who you're working with. I will
Mhm.
say, you do get to do a lot and you do get a lot of autonomy, which is really a great experience. It's also what you make of it too. So maybe you might have an attending who's a little bit more hesitant in the beginning, but you really start to show that I'm here and I'm listening and I want to help and I prove myself, and they
Mhm.
give you more and more responsibility. So yeah,
Mhm.
you can deliver babies. You can be the right-hand man in surgery. On my OB-GYN rotation, you did it all. So usually there's like a surgeon and there's like an assisting like surgeon. He
Mhm.
didn't have those. The medical students are the assisting surgeons. So I
Really?
would have the like nurses, like you're like kind of scrubbed in, and one of the techs is like, "Oh, so you know what your residency are you?" And you're like, and I literally said this. I was like, "This is my first day of my third year. This is the first time I've done this." And they look at you like, "Oh, okay." So
And then you're
you
just so intimidated
it,
by that
you
whole
know what?
thing.
If something is ever too much for you, you can say that. You can say,
Mhm.
you know what? Thank you so much for this opportunity. I would really like to watch a little bit first to get a little bit more comfortable. You don't have to, a lot of them are they're very kind. Like
Mhm.
they were in your shoes and they understand that as well. So I've had some that were putting in like a central line, and he was like, "Do you want to do it?" And I was like, "Can I watch you do one and then I'll help on the next one?" Because I was like, I don't want to kill someone. I can't handle that. And you're not going to. They're never going to give you something that they either cannot fix or you're going to do something that's going to really mess somebody up, okay?
Mhm.
But yeah, you can play and give and take with all of it, but they let you do a lot. So
Oh,
it's a
that's
great
great to hear.
experience. Mhm.
Thank you.
All right. Miss Jefferson, I think you are next.
Yes, thank you. I'm just wondering, is there a mentorship or advising system in place for students as they decide which clinical rotations to apply to, or even which residencies to apply to?
There is so much mentorship. There is so much mentorship and advising. Yes. So students are assigned academic advisors, which may be clinicians in years 1 and 2. Any of our faculty are available for optional advising if you want a second opinion or want to talk with, let's say you're really interested in pathology, but your advisor is a psychiatrist. You can go talk to the pathologist. And then when it comes to scheduling rotation preferences and fourth year things, of course, you have your individual rotation coordinators who know all of our sites internally and have a lot of experience working with students. And then we also have a dedicated GME team, graduate medical education, that specifically works with students toward their setting up their fourth year and residency application. So I almost look at it as like a timeline of overlapping mentors, where there's so many people at the table with you, and it's really just a matter of how much mentorship a student wants.
That's great to hear. Thank you.
Let's see. Next up is I think is it Nika?
Hi, it's NECA. Sorry, I'm trying to turn on my video for some reason. Didn't show. Thank you so much for organizing this presentation. It's quite informational and it's a great opportunity to meet with you all. I actually have two questions, one for you, Dr. Terry, and one for Tatiana. In regards to, for you, Dr. Terry, in regards to the rotations here, are there any opportunities that allow students to pursue deeper scholarships, such as like quality improvement projects or working on health disparity research? And then for Tatiana, how has your experience at CHSU like shaped your professional identity, not only as a future physician, but also as a leader and advocate in medicine?
These are the best questions. So, Nneka, thank you for the great questions. Before I answer your questions, I just want to point out that Matthew has a cat on his Zoom, and I'm really excited anytime I see an
Oh,
animal on Zoom. That is like just the highlight of my day. So, thank you, Matthew. Thank you to your cat for making an appearance. The question was about ongoing scholarship during rotations. And one of the things that you may or may not have heard about in other CHSU, oh, and there's a small person on your screen, NECA, so that's
Yes,
exciting
my
too.
little one. Yeah, sorry.
I am
I'm just
and anybody who has a guest or a visitor or an animal, here's your chance. We love them. It's awesome.
Thank you.
So, um, and a
Oh
good
boy.
good.
Oh boy.
You're like moving the camera. It's
Yeah,
good.
sorry. So
Um,
embarrassing.
no, it's great. And that's another thing too. We could talk about, CHSU's approaches toward, students with families and animals and all the different ways our community comes together. So our students during their first and second year are part of physicians' role in health systems research projects. So every student who goes to CHSU come, and this is something that we love for our students, is they, by the time they graduate, they have at minimum a research poster and often a peer-reviewed publication. And sometimes that research will continue into third and fourth year. We think that's something that really sets our students apart is every student is part of a research program or class. For students who want to do additional research, by all means, many of them do. And you can expect and anticipate with the incredibly competitive residencies that our graduates have gotten, many of them are involved in research, everything from 3D protein modeling to clinical research to pharmacologic research to literature reviews. And I've actually personally presented at national conferences with some of our students who have pursued research in their third and fourth year. So it's really just a great, what our dean says is it's highly unlikely, not impossible, highly unlikely that the cure for cancer will be found by one of our students while they're a student here. We're not a research university. However, our students do a ton of research and scholarship. And, perhaps Tatiana can speak about her experiences and that as well as we transition to your question for her.
Yeah, so then I'll kind of jump in just from the end of that loop of the conversation. I have never been a very big research person, so I'll put it straight up out there. Doing my teaching year opened a lot of opportunities to do research where my boss, Dr. Pryor, he's like the chair of our osteopathic department, loves and adores research. And he has a statistics and masters of public health and I don't even know what else because he does so much. And there's a lot of research opportunities. So because you get to work a lot and very closely with a lot of our faculty, and a lot of them are also clinicians or PhDs who are doing research, it's really thrown at you. If you want to get involved, it's very easy to. That being said, the first semester, I would say, just settle in. Don't just get the hang of medical school, figure out your system and adjust to it. But we do have a lot of students that are on, first authors on a lot of different publications. I got to do a lot of research with my like osteopathic team. I think I'm on like 3 or 4 research projects. I got published for one of them and won first place at like a national conference. So that was really cool. And that also comes with more scholarships, which is wonderful. Um, I have had even things on my rotations. You'll run into a lot of preceptors that you stand out and you do something and they go, "Hey, what do you want to do? What are you passionate about? I will hop on a project with you." Or they have case presentations and other projects, which I've also been published, and they'll put you as first author for a lot of those things that go down into your application. So it's really great opportunities to take advantage, not just while you're in your preclinicals, but even like out on clerkships. There's a lot of research that's open to you for a lot of your attendings because they're very much interested in it as well. So if you show that interest, it's definitely there. I didn't even show that much interest and I got published on like a few different things. So it's there. You don't have to dive that deep to get it. For your question for me, it's a little different because I already knew what I was really passionate about. Um, as I said earlier, I grew up in Orange County, but my background comes from like the Middle East. And so I have my whole story and spiel, but underserved communities are very, very important to me. So a lot of like global medicine, working with like the Red Cross overseas is huge to me. But even coming here, so when I started my college, my undergraduate experience, I was at UC Merced. So Merced is, you know where Fresno is, right? Smack dab in the middle. Go like up an hour. Merced at the time was top 10 unemployed, uneducated, and most dangerous in the US when I attended there. And I got a phenomenal educational experience, not just from an academic standpoint, but just like culturally, systematically, medically, seeing health out there is very, very different. I knew that underserved it's a big part and a big story of who I am. So I may have already kind of had the underwriting of what was important to me prior to coming into school, but I think medical school helped develop that further. So it was really important for me, and that's why I was passionate about coming back to the Central Valley for medical school because I've completed my undergrad there and now my medical school training. So advocacy, especially for underserved communities and people who you don't have the same health literacy or opportunities or resources that, other places are more privileged to get is something that's really important to me. And I've gotten to do so much work with that, whether it was from the standpoint of what I've done during rotations or volunteering within the community. There's a great organization called Care Fresno. They help like at-risk youths in the community just kind of be a role model, help them with homework time, mentorship, stability in their life that they don't typically get. So a big part of helping this Central Valley is helping that next generation kind of grow up healthy and strong with the right kind of like education and support. So for me, looking at the mission statement, this may be like a very general med student advice rather than our school specifically, but look at their mission statement. Do you align with it? Figure out what's important to you, and that medical school will help foster that for you.
That is so well said, Tatiana. Thank you for that. I couldn't agree more, right? I mean, we love our school and it's a great fit for so many, but there's so many options with different versions of, of their missions. Tisha, I think your hand is up next.
Yes. Hi. Um, I'm not sure if this was answered. I just joined after clinic. I just wanted to ask, so like when like Dr. Terry has matched or like you guys are matching, what are like usually like the popular matched residencies from your college?
Yeah, and Tisha, that's such a great question. Thank you for joining us after clinic. Uh, I will share, I think we have some information on our website, and I'll pop that into the chat as well, unless one of the admissions folks beats me to it after I get done talking here. So our students match all over the place into incredible specialties. We do have generally about a half to two-thirds of the class pursuing something that might be considered a primary care residency. So it might be family medicine, internal medicine, pediatrics, and if you're following, sort of federal guidelines, some will say that includes women's health and psychiatry as well, which expands it a little bit more. Um, but then we do have a good number of our students that are pursuing kind of high level specialty areas right off the bat. We've had, ophthalmologists and radiologists and flight surgeons and orthopedic surgeons and just all these incredible specialties. And our students they're super competitive. We had, gosh, yeah, I'm thinking Tatiana about one of your original classmates who matched to a Stanford program in physical medicine and rehabilitation. Like we're
Oh
just
wow.
we're so proud of our graduates. And of course, I mean, I've dropped some big names here. It's not because that's what's important, right? We have a lot of small community programs that our students match to as well, because that's where they want to work, right? They want to be in a place where they get to practice using their Spanish every day and they get to work with, with farm workers and do that. And that's awesome too. But we really, our graduates do everything under the sun. And I'll see if I can get you a little bit more information about that.
Okay, perfect. Thank you so much. And I think Jeanette put something in the chat as well. So I just opened that up. So thank you so much. I really appreciate you guys taking the time to explain it. It's been super helpful. So thank you.
Let's see, Jules, you actually have your hand up.
I do. I just wanted to make sure really quickly that we address Arvin's question in the chat from earlier. It's a bit of a pivot topic wise, but he asked, "Hi Tatiana, what are some recommendations you have to adjust to the medical school atmosphere in your first 2 years, given that it is very fast paced and heavily loaded with studying?"
Okay, thank you, Jules. I appreciate that. I had like a little note on my paper to like come back to it, so I definitely appreciate taking the time for that. The first 2 years is a lot. It is a lot, and everybody tells you that. I don't think there is one way to do it. I think it really depends on every person, and I think especially when you first get started, you're going to try out a lot of different ways and figure out what works for you. So I've never been an Anki person. I don't know if people know what Anki is. It's like this like flashcard system thing that constantly shuffles them for you. And everyone was like, you have to be an Anki person. You can't be a pen and paper person. I pride myself on my pen and paper and my different colored notes, and that's the way that I learned. And they're like, that's not going to work here. And I went, okay. So I started Anki and I was like, what the heck is this? This does not help me because I am a big picture person who likes to tie concepts together. And that is what typically works in medicine. It doesn't mean Anki doesn't work. It's great because it gives you that repetition, but it can be very passive learning. So I do think that's a great tool. When it comes to boards, I 100% use Anki, but I needed other things that also supplemented a lot of my learning. So you'll try and dabble a lot of different things. Um, I think there's no real one way to manage it. I wish I had like a cookie cutter recipe of how to tell you how to do things because I remember being in your guys' shoes not that long ago asking the same thing. And you really just take it one day at a time. You take it one lecture at a time, you take it one day at a time. I will say give yourself something to look forward to. I used to go, I just got to make it to the end of the month and then I'll be done with this block and then I can focus on the next one. And I learned that wasn't the right mentality to have because I wasn't setting something to look forward to. The thing I'm looking forward to is a big exam at the end and then check it off of my to-do list. And that wasn't the right way to go. Going, okay, at the end of this week, I'm going out for boba with my friends, or we're gonna go to a hike at the end of the month, or whatever. I'm gonna go see my family for the weekend. Whatever it is, give yourselves big and small little things to look forward to make it to that point. And I do think that really helps. It doesn't mean you're like on the floor screaming and crying and you hate your life, but there are moments that are very tough. Having a really good support helps. You'll become very close to the people in your medical school. I do not think we are cutthroat people that are aggressive, and you hear that at a lot of med schools. I did not ever get a sense of that. Um, my notes went to everyone. Whoever needs it, I want to help. And most people are that way, especially coming to a newer school. This is my reputation just as much as it is everyone else's reputation. So when you leave our school, you also represent me. I want everyone to have a strong name behind them. I want them to look at our school and be like, whoa, those are some great physicians because it reflects on you. So you'll find great support in a lot of things and you just take it one piece out of a time. There's a lot of people that are ready to help you and support you. Faculty are absolutely wonderful. So I don't think there's one way to do it, but I think don't be closed-minded on what way you want to study. Have a lot of good support and have little things that you look forward to, and you'll get, and then remind yourself of why you wanted to do this. Whatever reason, whoever, whatever it was that was like, I think I want to be a doctor. You hold on to that because that's what carries you through. You're going to do a lot of things for the next few years that you don't like and you don't want to do. We all do things we don't want to do to get to where we finally want to be. So just know that that part is temporary and you do it to get to the point in the part that you actually want to do.
Okay, I got my mic to work. I just wanted to appreciate your response. Thank you very much.
Thanks to you both. This is so fun. We should do this more often. Or we could do this for like 4 years. We could do that too. We'll find out. Jace, I saw you on there, and then NECA has another question, Tatiana, for you in the chat. I'll let you triage it this way. So, a good example of med student attending, working as a team to solve. Anyway, Jace, what you got? And can we see your cat again?
Yeah, I was just she's still here. She's just been sitting on my lap.
There we go.
Yeah, she's just been hanging out. She's with all of us. But I was gonna ask, so, like I'm from like El Cajon, like San Diego area, so like right by the border. So, we have a lot of, the health issues specifically for the Hispanic community near where I live. So I know CHSU, has a large Hispanic population that they care for, specifically the area, which is something I really care about with the Hispanic community and rural health. So I was wondering how often and what percentage of CHSU students end up going directly to working in the Central Valley?
Oh, cool. We've got some stats on that too. So it ends up being about a third to a half so far because, of our two classes have stayed in the Central Valley. And one of the factors for that is actually a lot of our students apply to be in the Central Valley, and not everyone will stay, right? Because all of our students get exposure to a residency program, usually in the Central Valley, and just about all of them do apply, but some of them might end up going closer to home, different things, different parts of the state. You're from a beautiful part of the state. Some students will want to, put their impact and healing the world back towards folks, down in Southern California. There's nothing wrong with that, but it is cool that we do see about a third to a half of our students staying here locally. One of the reasons for that actually is since we've started the school, and I think that it's been a big factor with the school, is that the number of residency spots has doubled. It has more than doubled since we opened our doors here in the Central Valley. And not only that, we are actually co-sponsoring several different residency programs here locally. So we have an internal medicine program that we help start and a physical medicine and rehabilitation or PM&R program that we've helped start. There's also some talk about us getting a psychiatry program started because every residency program does need some type of an academic connection or sponsorship to provide some of those different factors. So it's really cool. So if students want to stay here, there are increasing opportunities to do so, and it is an incredible place to train for so many reasons. But also, as we've mentioned, students do go, or graduates go all over the place with where they choose to go, and you're not sort of pigeonholed of, okay, the student only knows how to work in the Central Valley. One of the factors that's really cool is you might have seen that our programs do require medical Spanish in years 1 and 2. And we actually have a research project we're presenting in April for how that has impacted our students in their 3rd and 4th year. Para los estudiantes que siguen estudiando y hablando y usando el español cuando estaban en las clínicas.
All right, perfect. Thank you. Yeah, medical Spanish was one of the other reasons why I thought the campus was so unique and really special, really focusing on the communities that the, Central Valley needs to care for. So I really appreciate that. Thank you.
Yeah, it's our pleasure. We're not shy about the fact that we're a newer school, right? So our school hasn't been here for, I went to a med school that was 150 years old. Our students, we want them to be able to show up to every residency interview saying that they have extra tools. We want them to be able to perform as well, if not better than the student who went to the school that's been open for 150 years. So we empower them with the medical Spanish, the clinical nutrition, the ability to know how to use an ultrasound, right, that they have that's theirs to keep. All these things that we think really are going to enable our students to be successful. All right. Um, Any other questions? I do see actually I've got a couple private messages here. I'm not the folks who messaged me privately, I'm not gonna call you up by name, but I will read the question just because other people might have the question as well. So I received one message. Hi, Dr. Terry. Thank you for being here today. Thank you to anonymous applicant. I was wondering if there are opportunities for students to do rotations internationally or even short-term programs abroad. Um, we do not yet have international rotations that count for credit, but many of our students do volunteer internationally if they choose to during their breaks. Part of that is just our malpractice insurance doesn't extend outside of the United States. All students get liability insurance, so if you're blamed for something that happens with a patient, ours will cover you if you're in the States. It doesn't cover you if you are outside of the States. Um, but that said, I'm trying to remember where our students went with Dr. Bruno. They had this incredible trip. Um, but anyway, we do have international stuff going on. It's just not part of the curriculum yet. Let's see here, and and somebody messaged me his cat's name. Thank you for that. I'm glad to know about that and know that it is also a name of a food. I think naming animals after foods is awesome. Um, Any other, oh, let's see here. I've got another question here. Oh, that's a thank you. And thank you, Jeanette. Did you want to speak about DO care?
I don't know a whole lot about it aside from the fact that our students usually participate in kind of the preparation of things that get sent overseas and globally. But there are some opportunities through that, the student org here on campus. And so definitely something that is available to students. But again, like Dr. Terry said, if you go somewhere else, it's kind of on your own. It's not necessarily through the school because our insurance does not cover anything outside of the state. So, but it is something that students can get involved with for sure.
That's another really cool thing, actually, I think is worth mentioning, is that the DO opportunities internationally are incredible and ever increasing. Historically, being a DO meant there would be additional hurdles to practice internationally. Now there are less. I actually had a DO practicing in New Zealand reach out to me this week who wanted to talk shop about stuff. Let's see, and are there opportunities to engage in global health? I think we've somewhat addressed that similarly. You can do that, locally or abroad, but not necessarily for credit, but on the student organization side, students can do a lot of things on their own. Oh, Tatiana, I'm going to direct this question to you just because I've been chatting a bit and folks are eager to hear from you too. So let me know. You can bounce it back though if you want. Andrea in the chat says, what opportunities are available for students in the summer and how is that time spent?
Yeah, it's a really good question. Okay, so after your first year of medical school, you get a summer. It's like one of your only true summers that you get. And you can spend it in many different ways. So we do have a research, there's a better name for it. I don't know what it's called, but there's like a research program that we have with our school that you can actually work with some of the faculty and be like, oh, it's like a research intern. And so they pick a couple students to do it, and then you can actually stay in Fresno and continue to do some research projects and kind of get your feet wet that way. Especially because that first semester, like we say, we really don't get involved in research, just kind of like sink in and settle into medical school. So there is opportunities to do research. It's like an application process. If you get selected for it, you get jumped into a research project. Like I said, it's pretty much thrown at you, and you get to really get involved in it and understand a lot of the ins and outs. You're not going to be like a fly on the wall. You'll really get to do a lot of the like analysis, a lot of the, if it's like clinical, you'll get hands-on and actually get to do like trials if it's going to be something like that. So that is one thing that you could do. Um, you could also just go have fun, which is what I recommend that you do. Every time I talk to students, they're like, oh, well, like I'm just gonna like start doing Anki and like reviewing things. I'm like, yeah. Listen, you learned a lot in your first year. There's nothing you're really gonna do that's gonna help prepare you for the start of the second year besides really giving yourself a break so that you can come back fresh. And I never used to understand that mentality because I was someone that was like, as soon as like finals were done, I'm like, oh, I'm kind of like itching. Like, I feel like I need to be doing something. As soon as I went to medical school, that feeling went away because now you really do want the break because you're getting work to a whole different degree. So have fun, go travel, go do something. If it makes you feel better to do a little bit of light review, then by all means, go ahead and do that. Um, it's the same question that people tell me before they go into med school. Should they do like an anatomy prep class or, whatever? There's not much that you're going to do that's really going to make that much of a difference once you start versus taking time to decompress and relax and have some fun, I think would benefit you so much more. You can also do any kind of volunteering or experiences that you want. I used to work as an MA. I went back and I used to be a phlebotomist. And so I just did some shifts and I worked in the summer because it made me happy to get back involved in the clinics that were important to me and make a little bit of money on the side. So you can really do whatever you like with that summer. You could do research, you can volunteer, you could work, you can go have fun, you could study if you want to. So it's really up to you, which is really nice because that's your only real summer where you get to choose what to do with it. The one after your second year, it's technically you're not on a rotation, but you're in board prep, so you're kind of locked in. Um, there are limitations of like when you can start taking your boards and whatnot, but if you have like a span of 3 or 4 weeks, and this is where you typically take boards, and you just want to knock it out early because you feel confident and good enough, you can kind of give yourself a little secret break in there, like an impromptu one. But I wouldn't bank on it because, of course, you're focused on boards, and that's kind of the main priority first.
Thank you, Tatiana. And Jules has got maybe the last hand.
I think so. Since there are no further questions for now, I think now would be a great time to wrap up, given that we're 8 minutes over the 15-minute overtime. So thank you both so much, Dr. Terry and Tatiana. I really appreciate the insights. I think this was absolutely excellent. Thank you so much to all the prospective students for attending. And yeah, I don't know if Dr. Terry or Tatiana, I don't know if either of you want to put your contact information in the chat. No pressure, either way. But yeah, thank you all so much for attending, and have a great weekend, everyone.
I'm gonna drop my email in there. If anyone wants to reach out to me, I'm more than happy to answer any questions. I know sometimes it can be intimidating when you have admissions people on too. So if you have anything a little bit more personal, it will not stand against you. I am not gonna write your name down and hold it to you in any kind of regard. So anything that you would like to continue to ask or have anything you want to mention, I'll drop my email down. You guys feel free to email me, and I'll hopefully answer whatever your questions you have. It was nice to meet you all.
Thank you, Tatiana. For me, I saw the COM admissions email was posted. That's going to be one of the best ways to kind of triage things. I do admissions interviews and different things, so I try to keep my biases to a minimum because I end up liking everybody who I talk to. So send them through admissions, and they can help to get me involved when they need to. All right. Have a great weekend, everyone.
Thank you guys.
Thank you so much.
Yeah, thanks again.